Hi guys, and welcome back to my channel. If you're stopping right here for the first time, you're welcome. In case you're new here, I'm Ekemini, a student nurse currently based in Nigeria, and in today's video I'm going to be sharing with you guys some little medical terms that you all need to know. If you are not in a medical field, it's just easy for you to exempt yourself from this kind of situation, but that's a very big lie, because we all go to the hospital or you all interact with people, so it will be a very big shame for somebody to just throw a very slight medical word at you and you are very lost in your thoughts. You're like, what is she even trying to say? So that's why I'm making this video, for us to just get ourselves familiar with some kind of very basic ones. Anyways, it's just not complicated. These ones are the ones you can be hearing very often, and I feel like everybody should actually know about it. First thing you should know is that no one is perfect, in the sense that there is nobody that can know all the medical words. Nobody, even the professors of professors, cannot know all the medical words. So this is just me trying to bring out the very popular ones. In the process of this video, I was making a very thorough research about this topic, and I came out with a bunch, and I wrote them down in my notebook. There are many of them, so we'll just get right to the video. And the first thing I want you to know is that, am I talking too fast? Okay, slow down. The first thing everybody should know is that whenever you hear a word that has itis, that is itis at the end, just know it has to do with inflammation. There are some examples like arthritis is a common word. When you hear arthritis, you should just know it has to do with inflammation, and arthritis simply means inflammation of the joints. So we have pharyngitis, which is inflammation of the pharynx, which is the throat. We have laryngitis, which is the inflammation of the larynx. We have stomatitis, inflammation of the mouth. We have glossitis, inflammation of the tongue. We have pancreatitis, which is inflammation of the pancreas. We have bronchitis, which is inflammation of the bronchi. We have cardiitis, which is inflammation of the heart. So whenever you hear anything that has to do with itis, just know it means inflammation of that particular organ or body part. So that is one tip for you. Make sure you don't forget that. And also, you would want to grab a piece of paper and biro. You should jot some things down so that you'll not be able to forget them. So let's get to the number one I have on my list. So the first one I have on my list is dysmenorrhea. Now, it is not proper. I mean, as a lady, you should know the meaning of dysmenorrhea. It is not every time you be saying, oh, I have menstrual cramp. Please stop saying that word. Stop saying I have painful menstruation. No, please stop saying that word. Would you rather say I have dysmenorrhea? Thank me later. So please, instead of you to say I have menstrual cramp or I have painful my menstruation is no, just say I'm having dysmenorrhea. Doesn't that sound tush? I mean, anybody that hears you saying that will be like, this person goes school, or they will not know that it's just packaging. So that's just how this life is. So the next one I have also have to do with menstruation. It is amenorrhea, and amenorrhea is just absence of menstruation. In case you're not experiencing your menstruation, or you want to tell your doctor or your physician or your pharmacist that I'm not seeing my menstruation, or my menstruation is, just say I'm having amenorrhea. Your doctor is going to look at you in shock, and he's going to be like, wow. So amenorrhea is absence of menstruation. Don't forget, please write it down. The next one is dyspnea. I'm going to be including the writing on the screen. Dyspnea is just shortness of breath. Okay, there might be some cases where people with dyspnea actually has an underlying health issues, but sometimes it is not always like that, because dyspnea can happen because you've been exposed to, or you have actually strained yourself, you have done a hard work, or you have done exercise. You know, when you do exercise, your normal breath is supposed to be like, but when you begin to do, it becomes shortness of breath. The next one I have on my list is pruritus, and pruritus is itching, and you know what itching is, an uncomfortable sensation that causes you to scratch. So whenever your body is itching you, this one can actually be caused by many factors. Sometimes you notice that when you finish coming out from your bathroom, your body is always itching you. It might be because you are sponging yourself too much. When you sponge your body too much, it exposes your body to itching, which actually stops for after some time. So when you're having itching, instead of saying I'm having my body, just saying I'm having pruritus. The next one is Anorexia nervosa. This is actually an eating disorder that causes people to be very obsessed with their weight and what they eat. So if you're obsessed with your weight, if you're obsessed with how you're looking, if you're not comfortable with how you're looking and you're very conscious of what you eat, that means you're having anorexia nervosa. Another one is tachycardia. Now this one is very, very common. If your tachycardia is just high heart rate, like high heart rate or high pulse rate. When you are having high heart rates, when your heart is beating faster than normal, you are having tachycardia. So instead of you to tell that your girlfriend or that your boyfriend that why are you making my heart beat fast, just tell your girlfriend or your boyfriend, why are you giving me tachycardia, or you want to give me tachycardia. Your girlfriend or boyfriend will be like, okay. So, you know, surprise your loved ones with this little grammar you're learning. Stop saying you're giving me hypertension, you're making my heart beat. No. So you want to give me, or you're giving me tachycardia. So that is just what tachycardia means. So the next one I have on my list is psoriasis. And psoriasis is where the skin cells form scars or dry sensation. You know, some people, they do not have a very smooth skin like this. Their skin is always scaly. It's like fish, you know, fish, like Titus fish that you have to peel. So people's skin are as dry as that. So when you have that kind of skin, the medical word for it is psoriasis. Now, some of these words might not be as big as they seem. Like, the meaning of this word might not be as big as the medical term is. When, you know, sometimes when you go to the hospital and then the doctor tells you that you have this, because you don't know the meaning, you feel like, oh my God, I have this kind of, I am dead. This one is killing me. No, that's not how it is. When you actually check for the meaning, you just notice that it's just a small meaning attached to that big medical word that it is. So the other one is malaise, and malaise is a feeling of discomfort and unpleasantness that's, you know, sometimes it's just a feeling of discomfort. You know, sometimes, especially girls, when you have millions of mood swings in a day, you're happy this minute, the next minute you don't even know what's wrong with you, you don't even know how you're feeling. Even when they ask you, you tell the person you don't know, because you don't even know how it is doing you. But everything is all right. I mean, you have eaten, you have data, you have phone, you're not going through any heartbreak. You just don't feel pleasant, you just don't feel comfortable. That is what malaise is. Many people pronounce it differently, so whatever pronunciation you're going to give to it is going to be fine. But just know that malaise is a feeling of discomfort that is characterized by uncertainty, because the person doesn't even know what's wrong with him or her, and she can't even explain how she's feeling. She just knows that she's not comfortable, she's not fine, she's not okay. But what's wrong with you, I don't know. That is malaise. So the next word I have on my list is insomnia. Insomnia is very, very popular. Many people use the word insomnia, but in case you're new to the word, it just means you have a problem in falling asleep and staying asleep. And insomnia can be as a result of not eating enough food, because you know, sometimes when you don't have enough food in your stomach, you'll not be able to sleep. And even if you sleep, any little noise, anybody that opens the door, you're going to be awake. So that's insomnia. Instead of you to say I wasn't able to sleep, or I'm having, it's just a sleeping disorder, you just have to say you have insomnia or insomnia, anyone you want to pronounce it. And to prevent insomnia, sometimes it might have an underlying disease, like it might be an onset to a particular kind of disease or sickness. So if you're having insomnia, if you know it is not because like you ate well but still you can't sleep, or when you sleep, whenever any slight thing happens, you wake up, you have to meet with your doctor so that you just get to tell your doctor about what is wrong with you. Maybe there might be a sickness attached to it when tests are carried out on you. Other than that, or otherwise, it is just normal for some people who hasn't eaten well or who has gone through so many stress for the day and they're just trying to force themselves to go back to sleep. I hope that makes sense. Oh, another one I have on my list is nausea, and nausea is the urge to vomit. Many people use the word nausea, or many people actually know about the word, so it's not new. So if you're having the urge to vomit, especially maybe when you finish taking some particular kind of drug, sometimes when your pharmacist or your doctor prescribe a particular drug for you, they're going to tell you that the side effect of this drug is nausea. So whenever you take some particular kind of drug, you start feeling like you want to throw up. That's just the feeling of nausea. So otherwise, it's just like that. Alopecia, then it causes the hair to start falling off. So it is a sickness actually. The next one I have on my list is angina, and angina is chest pain. If you're having chest pain, not before you to say I'm having chest pain. Or when you go to meet your doctor tells you that you're not. When your doctor tells you that you're having angina, just know you're having chest pain. Another word I have here is asthenia, and asthenia is just weakness or decreased muscle strength. When your muscle is not strong, or when your muscle is weak, you yourself, you're going to be weak, because your muscle is what carries your body. Your muscle is what gives your body the movements and the capability to move around. So if your muscle is weak, you are automatically going to be weak. You will not be able to carry your daily activity. And the other one I have is myalgia, and myalgia is just pain in the muscle. It's just like the other one we finished giving. It's just like asthenia. So if you're having pain in the muscle, if you feel your muscle is paining you, just know you have myalgia. The next one I have on my list is hypoglycemia. Now, sometimes when you go to the hospital, you get to be diagnosed with when they tell you the sickness you're having or what is wrong with you, you now see them include hypoglycemia. When you see hypoglycemia, you should just know you have low blood sugar, like your blood sugar level is low. And then if you see hyperglycemia, you should know you have high blood sugar, which can actually lead to diabetes. So when you see people that have diabetes, maybe your brother, your sister, your uncle, your auntie, your mom, your dad, anybody that has diabetes, when you see the diagnosis he had, when you see where the doctor wrote his diagnosis, you will see that there is always hyperglycemia there. That means he has high blood sugar. So that's just it. Hyper is always high, hypo is low. Hypertension, that means your blood pressure is high. Hypotension, that means your blood pressure is low. So hyper is always high, hypo is low. That's another thing you should know about medicine. The next one is arrhythmia, and arrhythmia is irregular heartbeat that is other than the normal range. So the normal heartbeat for an adult is between 60 to 80 beats per minute. If it is below 60 to 80, if it is above 60 to 80 beats per minute, then that means you're having arrhythmia, which is irregular heartbeat. So you have to consult your doctor so that you'll be prescribed some drugs. You'll be given some drugs that are actually going to regulate your heartbeat. Aside that, we also have hypocalcemia, and hypocalcemia is a condition in which the blood calcium level is low. And when your blood calcium level is low, it makes you weak, because remember, your calcium in the body is actually supposed to make you strong. It's actually supposed to make your bones strong. And when your bones are strong, that means you are strong. So if you're having weak bones, you are not going to be able to be as strong as you should be. Now, for older people that can have this sickness, or for older people whose bones are weak, they can have osteoporosis. If you're young, Jesus, has it always been like this? If you're young and your blood calcium level is low, then that means you're having hypocalcemia. And hypocalcemia can happen due to insufficiency or deficiency of vitamin D in your body. So to boost your calcium level, you need to take food that are high in calcium. You need to take good milk, not just anyhow milk, all those saturated ones that are everywhere. You need to take good milk. You need to eat food that are high in calcium. Check for them online, you're going to see them. You need to also take some good vitamins, vitamin D. It's going to boost your calcium level and make your bone strong and healthy. Remember, without your bone, you can do nothing. So you need to be taking care of your bone as often as possible. So the next one I have on my list is syncope. And syncope is loss of consciousness. So if somebody is just like this, like somebody is just normal, all of a sudden the person faints, that means that person is suffering from syncope. Another one is anemia. Anemia is very, 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 very everywhere. Everybody is familiar with anemia. But in case you're new across the word anemia, it just means deficiency of hemoglobin in your blood. So if you're having shortage of hemoglobin is just the same thing as blood. So if you're having shortage of blood, that means you have anemia. So for people that just finished going to post-operative patients, people that just finish their operation, they might be having anemia due to loss of blood. So they will be giving blood to boost up their hemoglobin level. So boost up their hemoglobin level, their blood level. So that's just that about anemia. And the last one I have on my list is Leucorrhea. Leucorrhea is just whitish vaginal discharge. So if you're a lady and you're having whitish vaginal discharge, whenever you visit your pharmacist again, whenever you visit your doctor, please don't tell your doctor that I am having this whitish vaginal discharge. Just tell your doctor I'm having Leucorrhea or Leucorrhea. So basically that is going to be where we are going to end this video today, because I think I've exhausted all the things I wrote on my book, and I think that's the major things you need to know. There are also more of them. Don't forget, there are more of them. So if you're still interested, check them up online. Make sure you get acquainted with them. If you must, get a small piece of paper to just write them down, so that you'll be getting yourself familiar with these words, because they're going to help you someday, sometime, somewhere. That's going to be the end of this video. If you did enjoy watching it, don't forget to give this video a big thumbs up, subscribe to my channel, and share this video. And I'm going to see you guys in another of my video. Be sure to stay beautiful, and bye.